So I just want to share my own kind of personal experience. I think like a lot of people on this call, really kind of recognition of the injustice in the world and kind of systems of oppression is what drew me to a career in health. I think it was only once I got into school, in medical school in my case, that I really recognized that the systems of health service or other services in general weren't built in a way that were liberatory, right? They're built in a way that kind of maintains things the way they are, and really they're intertwined with the things that kind of keep people poor. So I really sought out Doctor for Global Health and this idea of liberation medicine to better understand how do I do the thing that I'm training to do, but do it in a way that supports liberation and doesn't just contribute to keeping things exactly the way they are. So I had the opportunity to work at DGH and Chiapas and El Salvador, and I went down to Oaxaca, and those were all amazing experiences. But I think the thing that affected me the most was really trying to get a grasp of what liberation medicine actually meant and how I could apply it to my work here. And I just wanted to give the example of incarceration and the police, because this is a thing that's very topical right now. And I just want to show how a liberation medicine framework can be applied and how it can be different than traditional medicine or public health. And like Linda was saying in the example in El Salvador, where, as providers, we want to do the thing that we're trained in, but we don't recognize that sometimes it can actually lead to harm if we don't have the appropriate framework. So I just want to give a little bit of quick background regarding kind of incarceration in the United States. So we're infamous. We have 5% of the world's population, 25% of the prisoners. Here you can see our rates of incarceration compared to other countries. No surprise to people on this call, likely that it's not a random swath of society we're incarcerating. It's particularly Black and Brown communities. It's also particularly communities that are poor. And you can see in the chart on the right, particularly women who are poor that are disproportionately incarcerated in the United States. This chart just shows that, our system of incarceration is not, something that's inherent to society or the United States. It's something that was created by policies, by people who are in power, people who benefit from the system. You can see that from the 70s onward, we see the number of people incarcerated just rapidly increases. People refer to this as like mass incarceration or the prison industrial complex. And it's important to recognize that this happens at the same time where we're divesting from communities that need it. There's a loss of jobs to other countries. We have the war on drugs that's created to incarcerate people. So all of this really comes together to, also we have people who are, close down mental health hospitals, and we put those people leaving those hospitals into the jail systems. And for healthcare providers, we know that, people in the jail system have a lot of medical conditions, not young, healthy people. All the chronic medical conditions are more common in the jails and prisons than they are in the general population. And here, we see, this is what I was kind of talking about. We had mental health hospitals where people with mental illness would stay. There was problems with those. And there was always this plan, we're going to close these and we're going to open up community-based systems of care. The problem was that politicians and people in power never really wanted to fund community-based care. So people who left the mental health hospitals ended up in prison. And this just shows that people kind of coming in and out of prison die at rates that are much higher than the general population. And in Los Angeles, this is really where I want to kind of focus, the story of liberation medicine is we were particularly infamous in the sense that we incarcerate and we have the largest jail system in the entire world, anywhere from 17 to 19,000 people at any given time. And people refer to it as the largest mental health institution in the world, which is doubly sad in the sense that, what we've invested in is jails to take care of people with mental health issues. And here you can see the amount of money for every dollar we spend on giving money to the sheriff. So when people are talking about defund the police, defund the sheriff, this is what they're talking about. For every dollar we give for the sheriff, there's 50 cents spent on mental health. And we know that if we take people with substance use issues and mental health issues, we can take about half of the people out of the jail system or more and put them into systems of care. So when you're, at protests and you hear, Black Lives Matter and defund the police, this is what people are starting to get at. And we also know that it's not random, right? People aren't getting incarcerated in the same rates in Santa Monica, like Linda was mentioning, as they are in Watts. It's we're disproportionately policing, incarcerating particular communities. So taken together, this is this idea of structures, right? Institutional racism, institutional oppression. It's a form of structural violence where the system's really built in a way that it harms particular people and keeps people from being healthy. So for a provider in this situation, how do you practice liberation medicine, or what does liberation medicine look like? And this is, I work in the emergency department, but I also work in the jail system. And the conversation that was happening when I started working in the jail systems is that, the jails are really crappy. There was all these lawsuits that came about that, the conditions in men's central jail are terrible. There's rats, there's all these other things, leaky faucets. What we really need to do is we need to build a new jail. So the thing on the table from the early 2000s was, let's build 2 new jails for, $4 billion. And on the surface, it's like, it doesn't seem like a terrible idea, right? There's terrible conditions. People we care about are in these jails. We don't want them to be in these conditions. But activists, healthcare providers, and people who had been incarcerated were like, hold on a second. Why do we even need to build a new jail to begin with? And this is where the kind of difference comes in, right? So if you're a provider and you're working in the jails and you just see bad conditions at your clinic, you're gonna be like, yeah, I want a better clinic so I can provide better care. But in partnering with the community that's affected, you broaden your gaze a little bit and you recognize that, hey, maybe we don't have to play this game of no new jail or a jail that's a little bit nicer. Maybe there's a third option that wasn't evident before. And that third option is maybe we can take all these billions of dollars and just put it somewhere else and invest in the communities. And that's kind of more of a liberatory practice. So since the early 2000s, health providers partnered with activists, organizers, groups like Justice LA to be like, hold on a second. Even though the board of supervisors in the county had already signed a contract to build these new jails, they're like, we don't want this. And through just concerted effort over more than a decade, people were able to stop the board of supervisors and cancel this contract for a $1.7 billion men's jail, and then also a women's jail that was going to be like $1 billion also. So then they brought in the healthcare providers again, and they're like, what do you need? They brought in Department of Health Services, which is kind of the county health system, and they're like, okay, that's right, we don't need a new jail. Maybe let's build a mental health jail. So we know that there's a lot of people with mental health problems. So let's just build a jail that's really good at treating mental health conditions. And, people kind of patted themselves on their back. They made a new website. It's called the Correctional Treatment Center, something along these lines. And it's going to be this huge facility. It's a locked facility that provided mental health care. And again, the providers in the jail, it might have made sense. It's like, okay, we're going to provide better mental health care. But by partnering with people who had been affected by, incarceration, by their families and activists, it became evident that, hold on a second, why are we even adding jail to the end of mental health jail? Why don't we just provide mental health services? So again, people got organized, people, went to these meetings, people had rallies, they had protests. And again, what came out of that was, this was the step before. So this idea that we're going to replace the jail with a mental health hospital. So that got undone. And just a few months ago, the decision was made that we're going to adopt this thing that's called the Alternatives to Incarceration platform, which basically says care first and jails last. And this was very much informed by, kind of defund the police, the prison abolition movement, which was, we have to undo this system. And the reason so many people are in jail, part of the reason is we haven't invested in communities. And people don't have jobs, people don't have housing, and we're putting all those people in the jail. So let's undo that history, take these $4 billion and let's put it back in the community. And recently, just about 2 or 3 days ago, this same, movement of folks got the board of supervisors to basically say, not only are we not going to build a new jail, not only are we not going to build a new mental health jail, we're also going to put forth the plan over the next year to bring down men's central jail. So over the course of about, 10 years or so, we went from spending 4 point something billion to building 2 new jails, to now we are going to actually decrease the size of the jail system by 1 jail, hopefully within the next year or so, and put that money back into the community. So the reason I really share that is that it's very easy as a health provider or doing service of any kind to just, like Linda was saying, when people went into El Salvador after the war, it's like we want to provide medical care. But if you actually listen to the community, as in this case, it's like, I just want to provide better care to the people I'm working with in jail. But when you listen to the community, it's like, we don't want better care in a jail. We want better care and we want better health in general. So I just wanted to share that as an example of what liberation medicine can look like in a more local context.